So if I'm a new patient coming to your office, what can I expect with my new patient visit and my treatment with you?
Well, first you'd sit in the reception room and listen to beautiful music, and then you would be given a clipboard with a health history questionnaire on it, which you would fill out. And you discuss all your previous injuries, and if you have a new injury, what goes on, what kind of car you were driving, if you fell off your skateboard. So you would do a health history. And then I would come and take you to my little room, and then I would do a consultation. So we'd go over your health history and ask you questions more detailed, and then other questions that you hadn't thought of. And we talk about old lab work or old x-rays, what your experience has been with other doctors, and your immune histories. So we learn a fair amount about you. And then if it's pertinent, we then will do a bit of exam, sometimes more elaborate, sometimes more abbreviated, a lot of it more orthopedic, where you're actually looking at movement things and general motion. And then, if it's relevant, then we'll take x-rays of the area of pain. So if you've had a chronic low back problem for 12 years, many times you've never had a diagnosis or an analysis. So we'll take an x-ray on that. And if it's too exciting, we'll follow it up with an MRI. But most things are amenable to just x-ray itself. And then I will go over the x-rays with you and the report of findings from your exam. And then we'll determine a diagnosis, and then I'll treat you based on that. And so after I do my report of findings, I will then do a full spine motion evaluation, where you're checking all the joints for their movement pattern, their ability to move, and then I will decide what area is most relevant to manipulate, and then that will be your first manipulation. And I'll usually give a treatment schedule of some kind, and my average patient will come in the area of 7 to 12 times if it's been a chronic thing, sometimes much longer if it's way chronic. Most everybody is given stretching exercises to do, and I try to get people to buy my book if they can, which has all the stretching exercises all laid out in order, plus all the other theoretical essays.
And nutrition.
And nutrition. So that would be first visit. And then the patient on the next visit would come in, and we've already done all the preliminaries, so they would sit down on my little stool, and I would do another motion palpation evaluation, checking all their joints, and then determine what the likely issue of the day is, and then we would do manipulation on that. If it was a joint, if it was a problem that wasn't joint centered, it was more muscular, then we would do more muscle therapies, trigger point therapies, Rolfing type deeper work. Many times what appears to people to be like acupressure, but it's actually a little different system. And then we go from there.
Great.
So then each time they come, we see how different they are. And then when they get to the point where the motion is there and the joint is competent to move in its directions, then we get rid of them and tell them to come back in a month to evaluate and to do the stretches in the meantime. So that's kind of a general overview.